So good morning, everybody. It's a huge pleasure to welcome you to our webinar titled Research with the LGBTQ+ community. I've got some really quick housekeeping reminders to run through. Our presentation today is scheduled to run until 12:45 and the session is being recorded, so please do remember to keep your microphone muted. That just ensures we don't pick up any background noise. We have time dedicated to questions at the end of the session, and if you're wanting to make a comment, a contribution, ask a question, please pop your hand up or put something into the chat and we'll try and get around everybody. The slides from today will be emailed out after the presentation along with the recording and an evaluation form which only takes a minute or two to complete, and that provides really valuable feedback for us as we progress the offer from the Specialist Centre. So we'd really appreciate you taking the time for that. For anybody watching the recording back, if you want to offer any thoughts, there'll be a QR code at the end of the YouTube clip, and that will take you to the evaluation form. So please add your thoughts to that. So I'll now hand over to our team of presenters.
Good morning, everyone. Welcome to this morning's session on researching with LGBTQ+ communities. This session has been co-developed by the NIHR in partnership with the Diversity Trust CIC and myself in the role as a public involvement and community engagement specialist. I'd like to start by introducing the team who've worked on this development and who will be delivering the session this morning. Next slide, please. Sorry, excuse me. My name is Rick Patterkey and I'm the Public Involvement and Community Engagement Lead and Public Advisory Group Chair for the Medway Health Determinants Research Collaboration. I currently sit on the Independent Advisory Group Board for the Kent Police and volunteer with Medway Health Watch, and I'm part of the National Public and Community Partnerships Advisory Board for the Research Support Services Specialist Centre for Public Health in Newcastle, within my role as the PIC lead. I'm also a proud member of the LGBT+ community and lived with professional experience in homelessness, mental health, disability and loneliness. And I've drawn on that experience in creating a space where individuals and communities can flourish. Next slide, please. I'm joined by Dr. Lauren Hall and Jodie Clark. Lauren is a methodologist at the RSS Specialist Centre for Public Health and co-lead for EDI for the Centre, where she leads on projects and practices that strive to include underrepresented groups in research and other related activities. Jodie is an EDI and inclusion trainer and consultant specialist in LGBTQ+ inclusion with the Diversity Trust CIC. They have experience in community organising and peer support, advocacy and activism, and lived experience of mental health, addiction and recovery, gender-affirming healthcare and the intersection of queerness and faith. Next slide, please. Over to Jodie.
Thanks, Rick. Lovely to see you all this morning. So yeah, just to kind of give you an idea of what we're going to be covering this morning, a little bit sort of the idea of how you want to run the space. So it's as safe a space as we can make it. When you are asking questions and engaging, we ask you to be accepting and mindful of different levels of experience and awareness around some of these issues. Again, for the Q&A and audience engagement segment, if you can afford each other a little bit of confidentiality, so please after the session talk about what we've talked about, but don't, for example, go back and be like, oh my goodness, you'll never guess what X person asked, because we want everybody else to be able to engage safely. I am reliably informed this is called Chatham House rules. Please do ask questions at the end. Feel free to pop questions in the chat as we go as well, so we can come back to them at the end if needs be, and you don't have to remember it for the whole session. And the last thing I'll say is take care of yourself. There's a couple of things that we'll touch on that might be potentially upsetting, so feel free to take a step away if that's something that you feel you need. Next slide, please. So in today's webinar, we're going to be doing a kind of quick introduction and primer to sex, gender and sexuality. We'll do some scene setting around LGBTQIA+ health inequalities, ideas around language and engagement, data collection analysis, some of the main barriers to engaging LGBTQ people and communities, some advice and guidance on how to access LGBTQ plus communities, and a little bit on welfare and safeguarding for both researchers and participants as well. Just a quick note, we won't be having a scheduled break simply due to the time of the session, the time constraints of the session. And also, just so you're aware, at the top of the session, you should all have had access to an LGBTQ plus glossary of terms. So please refer to that if any of the language is eluding you at any point. It should be defined in there. Sorry, next slide. So the goals for today, the learning outcomes we'd like to achieve is we want people to leave feeling confident talking to and about LGBTQ people and experience, understand some of the different identities and experiences within that community, understand better how to approach LGBTQ plus communities and some of the barriers you can encounter in attempting to do so, confidently undertake and produce research with LGBTQ plus communities, and last of all, feel confident building and maintaining relationships with research communities and communicating the value of your research as well. Next slide, please. So we're going to start off having a look at sex, gender and sexuality. Next slide, please. So this is a really broad and complex area. So for the purposes of today, we're going to keep it really simple. In this conversation, for the purposes of this session and the research, sex typically refers to the body, the physiology, so someone's physical embodied self. And gender typically refers to cultural, social and psychological ideas that we overlay on top of that biology. In day-to-day speech, however, it's very common to find these things used interchangeably. So you might see people referring to their gender or their sex interchangeably, but we tend to pass them out for research purposes. This distinction is blurry, and the ways that sex and gender interact are really complex. So, for example, you have instances like medically unnecessary surgeries being performed on intersex infants. So this is where a baby is born with a physiology, with a body that is not typically male or female. So it could be they have ambiguous genitalia or some other kind of unexpected manifestation in their body. And it is very normal for a surgery to be done on those children in order to make them conform to our ideas of what male and female are. So we can see in some instances how cultural ideas of gender shape ideas of sex. And we also have sometimes this idea that sex and biology is objective, but again, the meaning we make of it is culturally informed. So a lot of us are familiar with the story of the sperm and the egg. Certainly when I was growing up, I was taught that the sperm are very active and they swim and they race, and the egg just kind of like bumps along and sits there waiting passively for a sperm to arrive. We know now that it's much more complicated than that. The egg is very active in deciding which sperm it grants access to. It can make all sorts of changes to its environment to be a selective agent in that process. But our ideas of masculinity as active and femininity as passive for a long, long time shaped the story we told about a biological process. So beyond the scope of today, but there's a messy interaction, and I would encourage everyone to learn more outside of this session about that. Next slide, please. So sexuality refers to someone's sexual or romantic orientation, i.e. who they are attracted to. So how someone identifies doesn't always align with practice and orientation. And what I mean by that is there are some people who identify as straight, but who engage in same-sex activity. So for instance, you might have married men, married to women, who are quietly engaging in same-sex activity, but would still identify and live and describe themselves as straight. Similarly, there are people who repress their sexual orientation. So you can't always rely on how someone identifies as being a reliable indicator of their actual sexual practice. Sexual orientation and culture overlaps with different gender practices and expressions. So while these things are distinct, they have a shared relationship. So, for example, homophobia is often tangled up with prejudice against femininity in men or masculinity in women. If we think about ideas of what looks like gay, what gay looks like, it's very often attached to gender nonconformity or unexpected femininity or masculinity. So these things are wrapped up together, but again, it's important to understand they are also separate concepts, if that makes sense. Next slide, please. So we'll do a little bit of scene setting. Obviously, we're here in a public health capacity, so we're going to have a look at some LGBTQIA plus health inequalities. If I could have the next slide. So mental health is one of the most talked about areas of LGBTQ health. There's a lot of research data on this at this point. Most surveys find that LGBTQ plus people do report higher rates of things like depression, anxiety, self-harm and suicidal ideation as compared to their cisgender and heterosexual counterparts. LGBT people, so this particular survey was looking specifically at lesbian, gay and bisexual people, found that people were around twice as likely to report poor mental health. That's for generalized adult LGBT people. They were 1.5 times more likely than their heterosexual counterparts. For the over 55s, that actually went up to twice as likely for various historical reasons to do with formative experiences around sexuality under quite different political contexts. LGBT people are around twice as likely to have attempted suicide compared to heterosexual peers. And we can group this broadly under an idea called minority stress, which is to do with the way that experiences of social exclusion and othering impact on mental health and well-being. Next slide, please. There's also barriers to accessing healthcare, so I won't read through this entire slide. It's there on the screen for you to see, but broadly speaking, we find that LGBT people encounter barriers in accessing reliable healthcare. So it could be that there aren't understanding and supportive services available to them. It could be that incorrect or unreliable assumptions are made about sexual or romantic practice. We know that 14% of LGBT people say they have actually avoided a treatment because of fear of discrimination, and that actually is higher when isolated for trans and non-binary people. If you are fearful about being discriminated against by a healthcare worker or a professional of any kind, you will often wait until problems are more serious before seeking support. So yeah, we're aware that these barriers exist within systems. Next slide, please. And yeah, we need to also take a kind of intersectional approach to all of this research and understanding. So poor mental and physical health outcomes are tied to intersections between other experiences of minoritization. So for example, people who are LGBTQ plus and from minority ethnic background, or who are also disabled or on low income, will experience compounding and intersecting experiences of health inequality. We also know that homelessness is disproportionately common amongst LGBT plus youth, and homelessness itself is again strongly linked to poor mental and physical health outcomes. There has historically, although this is improving, been a lack of data collection on sexual orientation and gender identity in many health data sets. So while there is some good targeted research, broader public health research is still emerging. Next slide, please. So let's have a think about kind of the language around LGBTQ plus people and engaging with LGBTQ plus communities. Next slide. So again, if you refer to your glossary for some basic term definers, but some key kind of ideas I want people to have in their minds moving out of this session, a really, really good rule of thumb is follow the lead of the people you are speaking to or about. So you might find that different communities have what are called specific sociolects. So these are vocabulary and ways of talking about their experience that are unique to specific communities. For example, it might be that same-sex couples who are parents have different identifiers. So one might be mum, the other might be mama. You could have dad and pa as a way of distinguishing between the two parents while still both using the gendered terms that feel correct. Similarly, lesbian people often use gay as an identifier. It's not intrinsically male. And obviously you might be more familiar with gender neutral terms like partner in addition to things like boyfriend and girlfriend. It's just basically about having an open mind and being receptive to learning and following the lead of the people that you're working with. Next slide, please. Similarly, it's important to acknowledge different experiences across the acronym. So, for example, lesbians are experiencing intersection of homophobia and, in addition, misogyny and sexism, and they also experience transphobia. Both, if they are trans, they may experience transphobia, but similarly, you can experience transphobia simply by being gender non-conforming and being assumed to be trans. With gay men, they experience homophobia, but still retain a kind of contested and unstable male privilege, and again may also experience transphobia. Bi people face a specific biphobia that exists even within LGBTQ plus communities. So sometimes gay people and lesbians will be biphobic to bi people. There is not always harmony across the entire acronym.
to do this and opt for them to engage with staff about
Sorry,
this
sorry.
tract and support.
Could you just make sure you're on mute, please? I'm not sure who that was, but we just picked you up. And something else to be aware of, and it will come up throughout the session when engaging with these communities, is that trans and non-binary people in particular are being targeted nowadays in politics and media, facing very significant hostility. And we are dealing with the ongoing removal of previously established legal rights and protections. So that will factor into some of the trust and some of the barriers around engagement that we'll discuss later on. Next slide, please. Thank you. So some terms that you might come across around gender and identity, this idea of assigned gender at birth or assigned sex at birth, as opposed to born a boy or girl or biological sex. The reason that trans and non-binary people and allies and researchers in this area would often use these terms is to recognise that sex is a social legal process, sex assignment rather is a social and legal process based on information observed at birth. So it is both the case that intersex people exist. We think between around about 1% of people are likely to be intersex in some way. Similarly, you are assigned a sex at birth, and it may be that later you identify as a different gender. So the reason you'll see this term assigned gender at birth or sex assigned at birth is to recognise that biology is not the whole picture. We are people, we are more than simply our genitals or our chromosomes or whatever it might be. And it's also worth thinking about, is assigned sex relevant to your research, and why is that the case? We very often ask it as a default because we live in a cisgender culture. If you are looking for the experience of women in a workplace or men in a workplace, and you're wanting to include trans men and trans women in that, which would be the default situation, it's worth having a reflection on why you might be asking about assigned sex at all. It will depend on what the goals of your research are. Again, it is in your glossary, but just to clarify here as well, cisgender is the term that refers to someone whose gender identity matches their assignment at birth. So sometimes in discussion, you'll hear the distinction of trans women and biological women, or trans men and biological men. The correct and inclusive way to talk about this is trans people, so trans men, trans women, and cisgender men and women. Next slide, please. We won't stop to do this now, although obviously if you're watching the recording, feel free to do so, but a reflective exercise you might want to undertake to sort of start to understand how attraction and identity work outside of the default model that we're presented is think about the types of people you're attracted to. What features do you find attractive? Are you explicitly attracted to certain types of genitals, or is it more about certain gender expressions? Is it masculinity? Is it femininity? Is it strength? Is it height? What is it specifically that you're attracted to, and try and approach that through a lens other than I'm attracted to men, I'm attracted to women. It can be a helpful reflective exercise to kind of begin to pull apart some of these taken for granted ideas that we might hold. And it's also worth thinking about, there are many examples where a heterosexual couple or a gay couple, a couple of any gender, one partner might transition and they may stay together. And it is often the case that the cisgender partner has to wrestle with what that means for their label that they would use for their identity. If they are in love with this person, they transition, they remain together and are still attracted, it causes a moment of like, well, what does that mean for my understanding of my sexuality? So it's also worth reflecting on that, just to begin to crack open some of these ideas and preconceived notions. Next slide, please. Pronouns, I could talk about this all day. I'm going to do my best to stay on track. I'm a big old language nerd. Pronouns in English, we have three kind of main ones that we use for people. So we've got she, he, and they. She and he you're all familiar with. They, them is a newer one to a lot of people. However, it has been in the English language as a single gender neutral pronoun. It first crops up being used this way in 1375. So trust me, it's totally okay. Non-binary people such as myself use they them pronouns because using she or her feels wrong to us. It causes in many of us distress, discomfort and upset. They them just feels right, makes us feel seen and chimes with our experience of gender. You might also come across people using something that's called neopronouns. So these are much, much rarer. You might have seen some of them, things like ze, zia, them. In my experience with the community, the vast majority of people who use neopronouns will also use one of the big three, I guess. So they'll have a she, he, or they are happy to fall back on. And some people may also use a mixture of pronouns. If you're not used to using singular they, them in this way, just practice. You use it a lot already. You know, if someone leaves something in the lobby, you'll say, oh, someone's left their phone behind. You wouldn't say someone's left his or her phone behind. So we do all use they, them singularly quite naturally already. It's just a case of getting used to using it in a slightly new way for a lot of people. If you're not sure, you can ask people what their pronouns are, or ideally introduce yourself with your pronouns. That opens up a space for them to return and ask and offer theirs in return. It creates a little bit of psychological safety, and sometimes just asking someone can feel quite direct. Next slide, please. We've also got titles to consider. So we've got Mrs., Miss, Ms. Women have 3 for various complicated and usually quite sexist histories. Men have 1, that's Mr. And then we increasingly have a quite common gender neutral title now, Mix. So my post all comes to Mix Joni Clark. You might also sometimes come across M or Per. These are very, very, very rare, but you may come across them. The vast majority of non-binary people that I know who use a gender neutral title will use Mix. Most systems are able now to reflect this. If you find a system that isn't, it's worth contacting whoever it is to fix that. But yeah, just to be aware, it might be something you come across. Next slide, please. So what if you make a mistake? Often people are really worried about what's going to happen if I get it wrong. Are people going to be angry? Am I going to be labelled transphobic? The vast majority of times, no. We all exist in the world and we don't want to make a big scene of things either. So when mistakes do happen, it's uncomfortable. It can be distressing. It can be upsetting. All we would ask people to do is just apologise, correct themselves and move along with the conversation. Don't panic. Don't, freak out and seek comfort, because that then repositions yourself as the hurt party. So if you make a mistake, just go, oh, I'm really sorry, say the correct thing and move along. A couple of terms in this area that you might come across is the idea of misgendering. So this is when you use the wrong pronouns or gendered language for somebody, so accidentally referring to someone as a woman when they are a man. And dead naming is where you use somebody's old name. So many trans and non-binary people, myself included, change our names. If you accidentally use my old name, we might say that you've dead named me. But yeah, all you need to do is apologise and move along, and we'll be okay. Next slide, please. So I think it's data collection and analysis now, which I believe is Lauren.
Yeah, thanks, Joni. So in this next section, we're going to have a think about some of the ways that we can approach collecting and analysing data. Next slide, please, Alex. One really good resource to use, and one that's informed this section of the session, is that If We're Not Counted, We Don't Count report, produced by the LGBT Foundation. So this resource is available online, and it provides a lot more detail and guidance around some of this work. And it gives information on the collection and coding of data around sexual orientation and gender, and draws on best practice guidelines and standards, and consultation with LGBTQ plus groups and organisations. Next slide, please, Alex. So sexual orientation, I'm going to go through some of these examples as to how to ask certain questions for data collection, and how to code the responses, which you can see on screen. So for sexual orientation, the one on screen is a really good format. It shows the categories and how non-responses or non-known responses can be coded. So it's based on the Information Standard for Sexual Orientation Monitoring, which was published by NHS Digital and NHS England. And it also provides other options for sexual orientations that aren't listed here on our slide. So we need to remember that there's lots of ways that people describe and identify their sexuality. And it's important to allow space for this. The LGBTQ plus community will notice when research doesn't allow options for them to honestly identify, and this can create some separation at the start of the research. So we equally want our data to accurately reflect the communities we're seeking to understand and represent as well. So it's twofold. We want to build trust, but also collect accurate information. Next slide, please, Alex. So I'm going to go through another two-part question for gender and trans status. So collect information around gender identity and trans status is often something which cisgender researchers are unsure of. So this approach using two questions was agreed as best practice by the LGBT Foundation, CliniQ, and Action for Trans Health, with input from trans community and the National LGBT Partnership. And they're also in line with the HIV and AIDS reporting system questions on trans status and gender identity. So in question one here, this establishes the respondent's gender identity irrespective of their being cisgender or transgender. So this is the most inclusive approach to take, as it allows people who may be trans men or trans women to identify themselves as men and women without being forced to disclose their trans status. Next slide, please, Alex. And in question two, where we ask if the respondent's gender identity is the same as their gender assigned at birth. So this two-part format recognises that trans men and trans women are men and women who happen to be trans. Not all trans and non-binary people are open about their trans status in all settings, as it can be unsafe to do so. So this format allows people more agency over the decision to disclose, whilst not forcing them into these these normative boxes. And at the same time, it allows for identification of trans or non-binary people in your data set. Next slide, please, Alex. So some considerations to think about with data collection and analysis. Free text response fields are the ideal gold standard, but this can create like a lot of additional work for coding and analysis on the researcher's end as well. So I just want everyone to think about like what assumptions might be made based on these questions. So for example, in a sexual health setting, a respondent might respond with heterosexual or straight and man, whilst still engaging in sex with men. So in this setting, it's really important to think about what you're wanting to know and why. For example, you could ask a question about sexual practice specifically to get the data that you need. Next slide, please. So moving on from the initial demographic data, we can think about approaches to take in interviews and focus groups as well, so more qualitative work. And we're going to talk about the difference between sympathy and empathy. So this is a really helpful starting point. Most people are looking for empathy, and certainly LGBTQ plus communities, like many marginalised groups, are uncomfortable or offended by pity. So empathy is the ability to understand and share someone's feelings, to stand with them in solidarity and recognise a shared humanity. So it's a stronger ground to build an effective relationship on than sympathy. Whereas sympathy would say like, sorry you're hurting, it's a shame that happened to you. Empathy would say, that shouldn't have happened and I'm here with you. Next slide, please, Alex. And it's similar with nice versus kind as well. So being nice in research might mean being overly agreeable and avoiding harm, any form of conflict or harm or negative feedback, which could compromise the quality and ethics of the study. Being kind, however, means prioritising the genuine welfare of participants and pursuit of the truth, even if it requires difficult but necessary actions or honesty. But sensitive discussions might not be immediately nice for the researcher. Next slide, please. So positionality transparency. So when we're conducting research and preparing materials for dissemination, it's really important to think throughout the entire process and to reflect on where appropriate and state your positionality in relation to the world and the communities that you're working with as a researcher. So this could include consideration of factors like your ethnicity, your social class or socioeconomic background, how where you were brought up, where you currently work or live, your gender identity and sexuality, whether you have a disability, or any other aspects of your identity or lived experience that might be relevant to the research. So being transparent about your positionality not only helps build trust and meaningful relationships with communities, but it also helps those who read your research outputs to understand your perspectives, assumptions, and lived experiences and how they shape the research process, interpretation of findings, and conclusions drawn. Jodie, I don't know if you want to come in here.
Yeah, so just some like an example, and I used to be one of the co-organisers for a trans and non-binary support group and kind of advocacy network in Leeds, where I used to live, and we used to get approached pretty often by researchers wanting to access and talk to non-binary and trans people, and they very often would just say, "This is the research I'm doing," and we would want to go back and say, "Okay, well, what's your relationship to the community? Are you trans and non-binary? Do you have any personal connection to this?" Simply because of the wider political and discursive context, there's a real awareness of wanting to understand what angle a researcher is coming at things from, and do they have the kind of capacity to approach it in that empathetic, kind way. So it's about redressing some of those concerns or fears or misgivings that communities may have, sort of based on both the political context, but also a history that has been quite problematic when it comes to researching gender and sexual minorities. And the positionality and transparency is a really, really important part of building that trust and overcoming that kind of initial barrier. Back to you.
Got it.
Are you on mute, Lauren?
Can you hear me?
Oh, I can now, yeah.
We have the next slide. There we go. Thank you. So active listening skills. So these skills on the screen can be applied to most interactions, but are especially important for engaging with marginalised communities. So there may be a perceived gap between participant and researcher, especially where the researcher is not a member of the community or is working with an institution perceived at odds with LGBTQ plus people. So here there might be some overlap with trauma-informed approaches. So whilst this isn't this isn't in scope of our session, we think it's a really good thing to go and search to develop skills in research with LGBTQ plus people, especially when it comes to research in public health and social determinants. Next slide, please.
It's me again. Hello. Yeah, so we're going to have a look at some of the barriers to LGBTQ plus engagement. We touched on a couple of them so far, but we'll just kind of explicate them in a bit more detail. So next slide, please, Alex. So there's general, I suppose, subcultural barriers to engagement with research bodies and institutions, particularly where the positionality of the researcher is not as an LGBTQ plus person. And it kind of loosely can be grouped into these four strands, I suppose. So there is a pre-existing mistrust, particularly amongst trans and non-binary communities, who often have had experiences of quite hostile institutions, even those that are meant to support trans and non-binary people. Unfortunately, very often, I'm referring to the NHS, transition pathways and care pathways have been sites of trauma. So there is a predisposition towards mistrust amongst a lot of LGBTQ plus communities when it comes to researchers, often based, as I say, on past experience. Similarly, there's a kind of research skepticism. So this perception of risk and awareness of being rendered an object of study. There are lots of historical pieces of research by sometimes well-meaning, sometimes less so, cisgender researchers trying to understand these strange, deviant people who are, who are trans and non-binary or lesbian, gay or bi, and coming at it from a position of difference or deficit. And there's also this fear that research might be either misrepresented or the findings could be used in a way that is at odds with the actual needs and desires of the community. So there's a high barrier of proof and trust, I guess, to overcome often when approaching communities. All of which is contextualized, as I say, around in the current climate in the UK. Does mean a lot of LGBTQ people are on high alert for exploitation, for bad faith or ill-informed research. It is unfortunately the case that there is a lot of sort of junk science or misrepresented kind of findings out there in the world. So all of these things feed together to create a sense of guardedness, I would say, amongst a lot of LGBTQ communities when it comes to health research in particular. Next slide, please, Alex.
So barriers and solutions. So there's a wariness of research that does not explicitly and clearly have LGBTQ plus people involved in collection, analysis and interpretation of data. So we need to ensure and communicate that LGBTQ plus voices are represented in these processes. So you need to clearly state your positionality and articulate how risk of bias is being managed and mitigated. And you can also build in like project working groups with public contributors and co-produce throughout the whole research process. So this could be in your grant writing, proposal writing, research design, analysis and interpretation of findings, and dissemination. And we need to think beyond conferences. How do communities find out or get involved with your research? Next slide, please. So research may be perceived as extractive, wherein the researcher or team comes in, gathers the data, and then disappears with little clear sense of how the data will be used and minimal follow-up. So we must enable participants and those involved in the research to follow the research throughout and be clear of what the goal is from the research. For example, like what is the positive impact for the community? Also partake in co-creation of research with affected communities, attend communities events to share results and next steps, and communicate in plain English and provide participants a way to access the final reports and outcomes. We're back to you, Joni. Next slide, please.
Thank you. Yeah, so we're going to have a look now at some sort of some approaches you might take when looking to access LGBTQ plus communities with everything we've said in mind. So next slide, please, Alex. So really good starting place, as with a lot of things like this, is community mapping. So find out what groups are active in your area, identify organisers and community leaders. We're thinking about community and voluntary groups, peer support networks, advocacy groups, LGBTQ plus specific charities and third sector organisations. But it's also worth thinking a little bit more broadly about things like bars, cafes, bookshops, venues like nightclubs and stuff as well. All of these can be really productive ways to access different elements of the community. Again, thinking about what the target of your research is. And so there was some really amazing work done in Leeds by a local sexual health charity that actually looked at kind of going out into nightclubs and venues in order to reach people to discuss sexual health, because those were environments where that information was directly relevant and the people there might not necessarily engage with a support group or another kind of avenue of inquiry. It's also really valuable to know what's already happening, as it helps you avoid stepping on toes. That it is a reality that sometimes community groups and people who've been working for a long time with very little resource can feel quite territorial about the work they're doing and the area they're covering, the community that they feel a sense of sort of guardianship over. And as part of that, it is good to know that they already exist, so you don't set something up and then potentially lose an ally or a collaborator because they're cross that you've done something without coming to them. So community mapping helps you work out where to go first, and kind of most productively start those relationships off on a good foot. Next slide, please, Alex. Fabulous. So when it comes to making contact, if you have a personal connection with a group, perfect, amazing. Use that personal connection. That's really, really valuable, and it's going to be a much more fruitful way in, just because you come with a lot of that trust pre-established. If you don't have that pre-existing relationship, it's going to work a little bit differently. So I always recommend reaching out via social media or email. I would use your work email just in the interests of boundaries and sort of safeguarding, which we'll come to later. In that initial contact, explain what the research is. As we've covered, be clear on your positionality. Be upfront about whether or not the community is involved in the research, design and execution. If that's not the case, just be clear about how this is being managed and mitigated. It might be that you're approaching specifically with that management and mitigation in mind. So if so, say so. Ideally, find a named contact. So I remember when I was doing a lot of this community work, we did get a lot of requests. If you can make it personal, show an understanding or an appreciation of what that organisation does, its value to your research, that's going to go a long way to kind of helping people think, okay, this person's approaching this with the right hat on. I would also recommend using DMs, so direct messages or email, as opposed to open forums. So a lot of these groups will still have Facebook groups, for example. The reason I recommend not engaging on the Facebook group or wall initially, I don't know if it's still called a wall, I might be out of date there, I've not used Facebook for a while, but on a public forum, is that you very often then get lots and lots of people swinging in, expressing a lot of the things that we've talked about in this session. It can very quickly become people saying, oh, well, I need this and you've not thought of that, and da-da-da-da-da-da. And they might not even turn up to the research. So if you approach the organising group initially, they can help you engage with that group in the most effective way, because sometimes an open forum can become a little bit chaotic and difficult to manage. Try not to overburden one person or group. There's also always the risk that one person or group ends up being the spokesperson for a whole community or a whole region. Try and get that diversity. So especially I'm thinking here, it might be that you go to the bigger town or city in an area and think, okay, I've got this whole region covered because I'm speaking to people in this city or town. It is worth taking the time to see what's happening in smaller areas and get that spread of experience and input. And lastly, it's also really worth being upfront about remuneration. So going back 10 years ago, 15 years ago, when I first started doing a lot of the community activism and organising stuff, already there was a sense that sometimes researchers and big institutions would want to take up time and labour essentially, but not offer compensation. So whatever that looks like within the guidelines of your institution, just be upfront about it, because again, it will show that you understand the value of what it is that you're seeking from people. Last thing on making contact, I think, is just be prepared to meet with groups to discuss the research and any concerns they might have. They might want to meet with you just to kind of scope you out and get a sense of how you talk to them and about these issues. Again, just to establish that this is a safe and reliable project to engage with for their community. Next slide, please. So once you've kind of made that initial contact, you've also got to think about your relationship with these groups and communities. So be mindful of capacity. Often, you know, people are doing this in their free time with no additional resourcing or limited resources. I touched on it already, but again, avoid accidentally making one person or group a spokesperson for the whole community. It might not be your intention, but it can happen by accident. Sometimes you'll have one person who's super engaged and front and center of everything. So it's also being aware of, you know, are they being realistic about their capacity? Just have it in mind, basically. Really important to manage expectations. So what are people's contact preferences? What level of engagement do the group want? What can they offer? You know, maybe they meet twice a month. Do they want you coming along to one session a month, one every 6? Can they offer additional sessions? Just have these conversations. And maintain ongoing contact. It was quite common. We'd have people come in, collect the data, and then we might hear about them maybe once they've done all the analysis and it was over. But if you can keep people updated throughout the research process, that's really valuable and creates that sense of buy-in and co-creation that we've talked about. So yeah, it's thinking about what kind of relationship are you building here? Is it partnership or project based? Are you having them on as consultants or co-creators? Just be upfront about that and make sure that the relationship and how you manage it reflects that intention. Next slide, please. So I think we're on to welfare and safeguarding. So next slide, please. We're going to start off thinking about safeguarding for participants. So this is for community members that you're engaging with. It is really, really important, especially in this context, to think about intersections with other identities and the contexts of the people that you're engaging with. So if you're looking to engage with LGBTQ members of faith communities, for example, or communities with low acceptance of LGBTQ people, or additionally LGBTQ young people, all of these are environments where that person might not have a supportive community around them. They may be at risk if they're outed as LGBTQ. So you're going to want to think about where and when in-person meetings are held. Is it in a safe place? Is it somewhere accessible? Also really important to consider safety in terms of contact preferences. So I'd say it's vanishingly rare nowadays to have posts sent out, so it's probably not an issue for most people. But generally, check that you've got the correct mobile number for them. They don't share an inbox. Just make sure you're having these conversations so you can keep people safe. And make sure they can contact you via some alternative to email. So this is a really practical point of if you're meeting someone or they're coming in to do a focus group or a one-to-one interview, it might be that they're running late or they can't find where they need to get to, they need a way to contact you. This is particularly true if someone is visibly gender non-conforming or trans or something, and your interview is somewhere that maybe isn't the safest part of town, for example. It's important they can contact you and reach out if they need to. Obviously, it goes without saying as well for all research, but ensure that confidentiality and informed consent are clearly communicated, understood, and rigorously adhered to throughout the process. Next slide, please, Alex.
So, as well as safeguarding participants, we also need to consider the researchers. So consider your own safety and well-being as well. So, for example, like Joni said earlier, use your work email. Have clear, communicated and enforced boundaries. So work phone, acceptable contact hours, and also think about supervision. Consider data protection too, GDPR and transparency around data use and storage. And in some cases, you could use chaperones, especially if you're meeting vulnerable people. We just advise that you seek advice from your local authority, BCFE, university, or appropriate guiding body on this. Next slide, please.
So thinking about then welfare. So as I've mentioned a couple of times, trans and non-binary people in particular are under a huge amount of strain in the UK at the moment. But these apply broadly to LGBTQ people, particularly older groups as well. So be mindful of the impacts of this. You will come across higher incidences of anxiety, depression, other mental health issues, often largely as a result of living in a socially challenging environment. Answering questions about experience of healthcare, employment, housing, etc. That may, for a lot of people, actually require discussing very traumatic or upsetting experiences. So again, we've touched on it, but really would recommend seeking out support around trauma-informed interviewing and research. It's a really valuable approach and lens for a lot of this work. What this might look like practically is making sure that there's space for participants to stop and start sessions if and when they need, have check-ins and breaks clearly communicated, and how to enact them. So almost like a safe word if people need to stop, and consider meeting locations. So are they safe for visibly LGBTQ plus people to attend? There's in most big cities, there's community centres or venues or charities that might be able to share space or offices with you. It's about creating as much psychological and physical safety for participants as is possible. And just being aware that of that positionality again, there might be an additional complicating factor of, do they feel safe sharing stuff with you? So it's just making sure you're doing everything you can to indicate this is a safe environment for them to share and to feel those emotions and experience it without judgment, basically. Next slide, please. Sorry. So there's this additional idea of cultural competency around intersecting identities. So asking people what they need is often really valuable. It's great if you can have tools in your toolkit already, but often just when you're approaching people or before they come in for interview or whatever it might be, you can say, is there anything you want or you need to make this as positive an engagement for you as possible? Very classic one is consider the presence of alcohol versus using dry spaces. Loads of LGBTQ spaces are bars, nightclubs. It's important to make sure, well, it might be depending on your research, but it could be important to make sure that you're reaching other branches of the queer community, so hiking groups or book clubs or whatever it might be. Broaden that search, and also think about where you're hosting any events as well. Is it going to be safe or welcoming to people who don't consume alcohol? I've mentioned trauma-informed approaches a couple of times, but one last thing is just what expertise is available in your organisation. Can you involve colleagues from social care, for instance? It might be that you have resources you can draw on around you to support you taking a trauma-informed approach. Next slide.
For researchers and public members, so be aware of your limitations, both on a personal comfort level and a capacity level. And be aware of your practical limits, knowing what you can and can't offer when you're collecting data and building these relationships. And also think about how the session might affect you. So like the discussion of trauma, how that might affect you, emotional distress, and how will you hold space for this, signposting for support for you or others, and supervisional support. So people to talk to after the session about your well-being. It can be difficult as a cisgender or heterosexual person to avoid identification or defensiveness. So be prepared for participants to talk about experiences with cisgender or heterosexual people without becoming defensive. Next slide.
Fabulous. That is all of the content we've got to cover. So really, really appreciate you all listening. I really hope it's been helpful. And we've got, I think, about 15 minutes now for questions and answers as well. Just to let you know, the Q&A won't be recorded, so please feel free to engage openly and we will do our best to answer any questions you might have. Thanks, everyone.
Well, I think we'll bring things to a close here. We're just about at the end of time. So it's just left to me to thank our fantastic panel, Rick, Lauren and Joni, and thank everybody who's participated and attended this session as well. It's been such a rich discussion. The comments and questions, points of view, experiences that have been shared have been an absolute privilege to listen to, and thank you very, very much. And please do keep an eye on our sessions that come through. We are trying to listen to what the research community want and need. And if you're finding great practice or ideas and other sessions that you'd like us to look at, then please do get in touch. So thank you very much, one and all, and we hope to see you again soon.
Thank you ever so much.
Thanks, everyone. Thank you so much.
Thank you.